Over 300 people turned out for the We Have a Voice Child Abuse Awareness Walk, sponsored by the Suzanne Gresham Center, a division of Meridian Health Services. Jody Winger of Muncie walked with her 3-month-old son, Abraham.
Since having a baby, I've come to a wider awareness of child abuse, thinking of the implications of it happening to my own child and wanting to protect him from that, but then thinking about the other children who are in some sense vulnerable to that and who experience that on a daily basis. And I'd like to do what I can to help bring awareness to that and help bring an end to that, if that was possible.
It was a rainy afternoon, but the walkers stayed dry inside Ball State's Worthen Arena, pushing strollers, walking with their children, talking with friends and neighbors. This is the 4th year of the walk, and Meridian has raised more than $20,000 over the past 4 years. Bob Coles oversees clinical services for Meridian and is a former mental health counselor himself.
You know, without having a resource like this in the community, I mean, all those folks would not probably be able to get that service, to have those services, and they would either have to figure out where to go get it someplace else out of the county, and or just not get it. And I think, you know, we know that if that didn't happen, then people would be a lot worse off, and we'd have a lot more problems, you know, to try to deal with.
Meridian supporters and volunteers include board chairman Brent Webster.
A lot of us are very involved in a lot of not-for-profits, and I think when you look at the amount of time that you have to donate back into the community, you really go with where you're passionate. And I found that there was just a great connection with my interests and where Meridian was going, its strategic plan, and really its kind of global view of healthcare within our community.
Meridian offers a range of services. CEO Hank Milius says they're all designed to help clients improve their physical, mental, and social well-being.
Physical being primary care, we now offer that service. Mental health, we've traditionally done that for years and years. Social well-being is really this right here: child abuse, neglect issues. Our Child Advocacy Center, which is social well-being, reflecting that. Before we implemented the Child Advocacy Center, cases accepted for prosecution were about 25–29%. Since the Child Advocacy Center, we now have close to 80% cases accepted for prosecution. What that really means is the bad guys are being dealt with and the children are being treated. Breaking that whole cycle of child abuse and neglect. I mean, it really is significant to us.